Welcome guys to the very first clinical high-yield video discussion on this channel. In today's video, we are talking about Disulfiram-Like reaction, a very much high-yield topic in medical biochemistry and clinical pharmacology. If this video helps you in any way, please leave your likes, comments, or subscribe to join this wonderful medical family. Let's jump straight into today's video. As already introduced, the topic for discussion today is Disulfiram-Like reaction. To make today's lesson much more clinical and practical approaching, we will first take this case scenario. MG, a 50-year-old male, presents to the ER with acute onset facial flushing, pounding headache, nausea, palpitation, and breathlessness that began around 30 minutes ago. He reports taking metronidazole for a recent dental infection. He admits to drinking beer shortly before the onset of symptoms. On examination, he is alert, but has a blood pressure of 94 out of 60 millimeters of mercury. Heart rate is 120 beats per minute. Temperature reading is 37.1 degrees Celsius. And oxygen on room air is 98%. ECG done shows sinus tachycardia. There are no signs of rash, stridor, or wheezing. Chest examination is clear and heart sounds are normal. By the end of today's video, we get to understand the normal alcohol metabolic pathway in the liver. We will then use this established knowledge to explain MJ's clinical presentation. Now, to alcohol metabolism in the liver. Research done shows that when an individual takes in alcohol, about 10% of the absorbed alcohol is excreted via our sweat, breath, or urine. The remaining 90% of the absorbed alcohol is then transported to the liver by the help of the hepatic portal vein. Once alcohol lands in the liver, it is converted into acetaldehyde by the help of the enzyme alcohol dehydrogenase. But acetaldehyde, this intermediate product, is toxic to the body and the liver. Hence, it needs to be further converted to a less toxic byproduct. This is when the enzyme acetaldehyde dehydrogenase comes in. Acetaldehyde dehydrogenase helps metabolize acetaldehyde quickly into acetate. Acetate is then less toxic to the body. Let's take this section again because this will form the main building block of today's lesson. When an individual takes in alcohol, by the help of the hepatic portal vein, alcohol is then delivered to the liver. Alcohol is then acted on by the enzyme alcohol dehydrogenase. This helps convert alcohol into acetaldehyde. But acetaldehyde is toxic to the body. Research done even shows that acetaldehyde is also a carcinogen. Hence, the body then finds a way to convert acetaldehyde into something less harmful. And this is by the help of the enzyme acetaldehyde dehydrogenase. Acetaldehyde dehydrogenase helps convert acetaldehyde into acetate. Hope this is clear now. Here comes the game changer. What happens to acetaldehyde levels if, for some reasons, the enzyme acetaldehyde dehydrogenase is inhibited from functioning? The answer is obvious, guys. There will be no enzyme to convert acetaldehyde into acetate when an individual takes in alcohol. Therefore, acetaldehyde levels will keep building up in the body in toxic levels. Buildup of acetaldehyde in toxic amounts has been associated with unpleasant clinical manifestations like flushed face or the redness of the skin, sweating, headache, hypotension, or a feeling of dizziness, nausea and vomiting, and breathlessness. Let's now switch the gear to the clinical pharmacology section. In the management of chronic alcohol use disorder, the drug disulfiram is usually prescribed for such clients. When an individual on disulfiram therapy takes in alcohol, the individual starts having these unpleasant episodes of vomiting, palpitations, headache, dizziness, nausea, and vomiting. One may ask, but how does the drug disulfiram cause all these manifestations? Or what role does the drug disulfiram play in the management of chronic alcohol use disorder? The answer is straightforward. The drug disulfiram has an inhibitory effect on the enzyme acetaldehyde dehydrogenase. Hence, when an individual receiving a disulfiram therapy takes in alcohol, because of the established inhibitory effect on the enzyme acetaldehyde dehydrogenase, there is no enzyme to convert acetaldehyde into acetate. This further implies that acetaldehyde will then keep accumulating in the body or blood. This then predisposes the individual to these unpleasant clinical experiences of palpitation, nausea, vomiting, headache, and flashing of the skin. So basically, the disulfiram medication triggers these unpleasant clinical episodes when individuals who are being managed for chronic alcohol use disorder take in alcohol whilst receiving the disulfiram treatment at the same time. And trust me, guys, you wouldn't like to experience these episodes. The individual then tends to develop disgust for alcohol upon realizing that he or she experiences these unpleasant episodes when he or she takes in alcohol. These overall unpleasant clinical episodes that individuals receiving the disulfiram therapy experience when they take in alcohol is what is termed as disulfiram reaction. One notable medication worth mentioning again is the drug metronidazole. Metronidazole is an antibiotic that is used in the management for bacterial infections caused by anaerobes precisely. Metronidazole has also been noted to have an anti-protozoan effect. Now, metronidazole is also thought to mimic the mechanism of action of disulfiram, that is, the inhibition of the enzyme acetaldehyde dehydrogenase. This then implies that when an individual on metronidazole treatment takes in alcohol, because of the less functional acetaldehyde dehydrogenase enzymes, there will be no enzyme to convert acetaldehyde into acetate. This thereby means that acetaldehyde levels will also keep building up in the blood. This then produces a similar experience which resembles the disulfiram reaction. Hence, metronidazole is said to exhibit a disulfiram-like reaction when it is taken in conjunction with alcohol. Individuals with disulfiram-like reaction may present to the health facility with non-specific symptoms such as flushed face, sweating, headache, a feel of dizziness, palpitation, which is the heart beating faster than normal, nausea and vomiting, or breathlessness. There are other medications available that also cause disulfiram-like reaction. To help you memorize this, we form this mnemonic: metronidazole. M for metronidazole, E stands for ethanol, T for tinidazole, R for rifampin. Other medications like cephalosporins. Nitrofuran derivatives medications have also been noticed to be causing disulfiram-like reactions. I for imidazoles and T for tetracyclines. Now back to the main case scenario. With the case scenario, we are informed that MJ is currently receiving metronidazole treatment for a recent dental infection. We are then informed that MJ takes in beer, which contains alcohol. MJ then starts experiencing the symptoms of headache, nausea, vomiting, palpitations right after the alcohol intake. This is likely to be a disulfiram-like reaction produced as a result of intake of alcohol while on the metronidazole therapy. Now, let's move to Asia. Did you know that in East Asia countries like Japan and China, about 36% to 46% of the population have disgust for alcohol? One may ask, why is this so? In Asian ancestry, research shows that there is a variant of the gene ALDH2. This ALDH2 gene is responsible for the transcription of the enzyme acetaldehyde dehydrogenase. This variant then produces a non-functional or less active form of the enzyme acetaldehyde dehydrogenase. So when an individual in East Asian country which this genetic variant takes in alcohol, acetaldehyde levels will continue to build up in such individuals. Hence, individuals then start experiencing disulfiram reactions like headaches, dizziness, vomiting, nausea, and most importantly, the redness or flashing of the skin. This is referred to as the Asian flash syndrome. Now, the key takeaway message in today's lecture is: anytime you prescribe metronidazole for a client, always advise them to stay away from alcohol whilst on the therapy, or for at least 48 to 72 hours after the metronidazole therapy. One thing that examiners will always look out for when you are explaining treatment to a patient is to avoid alcohol whilst they are on metronidazole. Hope this video helped you guys. Please leave your likes, comments, and don't forget to subscribe to join this wonderful medical family. Until then, peace out.